Congenital adrenal hyperplasia introduction. Congenital adrenal hyperplasia is a group of genetic disorders that affects the adrenal glands and pair on one full-sized organs located above the kidneys.
Hello. In this health sketch, we want to talk to you about CAH, which stands for Congenital Adrenal Hyperplasia. Congenital means it's present from birth, adrenal refers to the part of the body affected, and hyperplasia describes the change that happens. CAH is a condition about hormones. You may have heard of the word hormone before, as there are lots of different types in the body. In fact, a hormone is just a chemical messenger, sending a message from one part of the body to another via the blood. The adrenal glands lie on top of each kidney, and their main job is to make hormones. The outer part of the adrenal gland produces two different types of hormones, corticosteroid hormones and sex hormones. The corticosteroids have a role in salt levels, blood sugar levels, blood pressure, and the immune system. The sex hormones are responsible for the changes that take place in boys and girls during puberty. So both these types of hormones are important, and having the right levels in the body is also important, particularly for corticosteroids. The brain tries to control how much corticosteroids the adrenal gland makes by detecting the levels in the blood. If levels are low, a signal is sent to the adrenal gland to make more.
Symptoms. The symptoms of congenital adrenal hyperplasia vary depending on the gene that contains the defect and the level of enzyme deficit. There are two main types of congenital adrenal hyperplasia: classic congenital adrenal hyperplasia and not classical congenital adrenal hyperplasia. In classical, this most severe form of the disease is usually detected in childhood, and not classic, the middle and more frequent form can appear in childhood or in the early stage of adulthood. Just in 95% of cases, the enzyme that missing in the people with congenital adrenal hyperplasia is 21-hydroxylase. Congenital adrenal, it can also be called 21-hydroxylase deficiency. There are other deficiencies of enzymes much less frequent that also cause congenital adrenal. Congenital adrenal transmitted in the hereditary partner called autosomal recessive. Risk factors and suffering congenital adrenal. But parents suffered congenital adrenal hyperplasia of carry of genetic causes disorder. People that are can't age groups, especially Ashkenazi Jews, but also Hispanics, Italians, Slovaks, and Gilbert and Eskimos. Conclusions. The people with classic congenital adrenal hyperplasia are at the risk of severity and adrenal crisis. The crisis is produced by extremely low levels of cortisol in the blood, which causes diarrhea, vomit, dehydration, low blood sugar, and shock. It is life-threatening medical emergency that requires immediate attention. It can also lead to adrenal aldosterone production that causes dehydration with low sodium level and high potassium level. The adrenal crisis does not occur if formed non-classical adrenal